States of America, and I yield back the balance of my time.
Mr. President, following the September 11th, 2001 attacks on the United States, the National Institutes of Health, the nation's medical research agency in Bethesda, Maryland, needed to secure its campus. The NIH grounds were always open to the public before that. Anybody could walk or drive through the 300-acre campus. They could do it freely. But facing heightened threats, officials planned to restrict public access and to build a wall. It was completed in 2005. The wall, black metal perimeter fence with guarded checkpoints, became the centerpiece of NIH's new perimeter security system. Signs were posted that said, "No trespassing." On its website, NIH states the purpose of this border barrier, they say, is that to ensure the safety of our patients, our employees, our guests, and our facilities. Now, NIH wasn't alone in building a barrier after the attacks in 2001. Across the street, the National Naval Medical Center, now Walter Reed National Hospital Military Medical Center, also walled off its campus, 243 acres. The walls have worked. Both NIH and Walter Reed remain safe and secure. Now we need to deal with a security crisis at our southern border. President Trump has requested $5.7 billion. It's about 1/1000th of the federal spending. The President wants to build more physical barriers, a proven border security solution. Because 30% of the border already has a security border. Congressional leaders from both parties have supported a border wall in the past. In 2006, Senate Democrats, including and then Senator Barack Obama, Senator Hillary Clinton, Senator Joe Biden, Senator Chuck Schumer, voted to construct a physical barrier on our southern border. But Democrat leaders now refuse to back the president's border security effort, prolonging the partial government shutdown that is going on today. Meanwhile, Democrats and media fact-checkers are out in force to attack President Trump. They insist there is no border crisis. Well, the facts are, in this January 10th Investor Business Daily editorial, yes, there is a crisis at the border, and the numbers show it. Number one, in terms of how the numbers show it, is illegal crossings are climbing. Last year, Border Patrol stopped more than 500,000 people trying to enter the country illegally. Well, more than 100,000 in October and November alone of this past year. That's a huge increase from the same time of the same 2 months in 2017. Second, apprehensions don't account for all illegal crossing. The Homeland Security Department estimates that about 20% of our crossers enter, which means about 104,000 illegal immigrants entered in 2018 alone. Third, the U.S. illegal immigrant population right now is massive. Currently, over 12 million illegal immigrants reside here, comparable to the entire population of countries like Chile, the Netherlands, Syria. Number four, illegal crime levels are higher than expected. The Center for Immigration Studies have found that non-citizens accounted for more than 20% of federal convictions, though they represent only 8.4% of the population. And number five, Presidents Reagan through Obama have acknowledged the crisis. In 2005, then Senator Barack Obama said, "We simply cannot allow people to pour into the United States undetected, undocumented, and unchecked." In 2014, President Obama described the border situation as a crisis, but he failed to fix it. Even President Obama's last Border Patrol chief, Mark Morgan, supports President Trump. He was actually on television just today. Trump didn't keep him in the job, but Morgan says building the wall is key to solving the security crisis, and the president should, as he said, stay the course. Still, Democrats refuse to negotiate with this president, so we can't reopen those federal agencies closed for more than 3 weeks. Here's the Homeland Security Department's latest assessment of the southern border situation. They say each month, 60,000 illegal immigrants reach the border. Drug smuggling spiked in 2018 with a 38% increase in methamphetamine, a 22% increase in heroin, and a 73% increase in fentanyl. We also saw a huge surge in arrests of dangerous criminals, including 17,000 adults with criminal records and 6,000 MS-13 and other gang members. In 2018, 60,000 unaccompanied children in 161 families reached the border, a dramatic increase from 2017. Many were victimized on their journey. Mr. President, Border Patrol areas that have enhanced or expanded physical barriers have actually seen a dramatic decrease in illegal traffic. That's why the President has requested additional funds to construct more barriers. The facts are the facts. We have a national security and humanitarian crisis at the southern border. The problem is the rise in illegal entries. We need to solve it. Walls work. The question is, do U.S. citizens living in at-risk border communities deserve the same protection as NIH patients and the staff in Bethesda, Maryland? All Americans want a healthy immigration system that enforces the law, that keeps families together. Democrats shouldn't be playing politics with border security. It's time to work together to secure the border, reopen the government, and protect the American people. Thank you, Mr. President. I yield the floor.
Mr. President.
The senator from Massachusetts.
Thank you, Mr. President. Today is the 26th day of the longest government shutdown in American history. Weeks ago, the Senate voted unanimously to keep the government open. The House has now passed multiple bipartisan bills to end the shutdown. But President Trump refuses to come to the negotiating table, and Leader McConnell refuses to let the Senate vote on these bipartisan bills. As a result, over 800,000 people across this country have been sent home or are working without pay. Senate Democrats are here to share the stories of people whose lives are being upended. And I want to thank Senator Murray for organizing these speeches and Leader Schumer for leading our efforts to reopen the government. I am speaking today on behalf of 8,200 federal workers in Massachusetts who have been affected, including TSA workers at Logan Airport, service members, air traffic controllers, healthcare providers, and staff at our national parks. One of my constituents, Janelle, works at Native American Lifelines of Boston, an urban Indian health program. This program does crucial work helping to meet the health, dental, and behavioral health needs for Native people in Boston metropolitan area. It's a contract site with the Indian Health Service, an agency whose funding has been cut off by the shutdown. Now, Janelle loves her job, and she cares deeply about the people she serves. She doesn't want them to go hungry. She doesn't want them to miss their appointments. She doesn't want them to be unable to fill their prescriptions. But she worries about what will happen if the government doesn't open up soon. A prolonged shutdown would be a major hardship for Janelle, but it could mean a health emergency, even life or death for her clients. Another constituent, Don, is helping Coast Guard families in Massachusetts make ends meet. His organization, the Massachusetts Military Support Foundation, has distributed over 5,200 pounds of food since the start of the shutdown. He knows that if the shutdown continues, he'll have to start draining his organization's budget. And that could mean he won't be able to help military families afford school supplies come next September. Janelle and Don's stories are just two examples of how President Trump is holding Massachusetts families hostage while he demands a border wall. And let's be perfectly clear about what the president is doing. The shutdown is not about border security. It is not about protecting anyone. It doesn't make us any safer that President Trump has padlocked the doors at the Department of Homeland Security, or that he's asking our Coast Guard, our FBI agents, our airport security, even our Border Patrol to work without pay. No, This shutdown is a manufactured crisis that the president is using to fan the flames of racism and bigotry, all so that he can distract the American people from demanding a government that works for them. This isn't a new playbook. It's one that Republicans and the president have been using for years. Over and over again, they try to pit white working people against black and brown people, gay people against straight people, young people against older people, people born in the United States against people who came here in search of a better life. Pit them all against each other so they don't band together, so that they don't demand real change. But here's the deal. The American people are on to this twisted strategy. They know that this government works just great for the rich and the powerful, but not for everyone else. And across this country, people are insisting on a government that's not just open for business, but a government that actually works for them. A government that expands health care coverage instead of ripping it away from grandparents and newborns. A government that tackles the skyrocketing cost of prescription drugs instead of selling out to giant drug companies that put profits ahead of patients. A government that ends the stranglehold that money has on Washington instead of stacking the government with public officials who are more interested in lining their own pockets than serving the public. I could go on and on in this list. I came to the United States Senate 6 years ago to fight for working families and to tackle these problems head on, to end a rigged system that created two sets of rules, one that applies to the rich and the powerful and one for everybody else. Republicans are trying to divide Americans in order to stop us from getting to work ending this rigged system. But we are on to their game. The president and Republicans must end this shutdown now so that hundreds of thousands of federal workers can get their paychecks and get back to work. If they don't, hardworking people like Janelle and Don and thousands more across Massachusetts will continue paying the price. Thank you, Mr. President. I yield the floor.
Madam President.
The Assistant Democratic Leader.
Madam President, last Saturday was a historic day in